Care to chat? Hello and welcome to our podcast from the Northern Ireland Social Care Council. Social care and social work are such enormously important parts of life here. They really came to the fore during the pandemic. And now with the crisis in the health service, they're in the news again. So in these podcasts, we're going to find out about these jobs, about the people who work in them, the routes into social care and social work, how staff can progress and develop their careers, and about the reforms taking place. And that's what we're talking about today. Social care workforce reform. What does it mean for you? What's happening around reform, care and practice? And perhaps most importantly, how is it going to affect you if you're working or considering a career in social care? Paul Rooney is Professional Advisor with the Social Care Council, and Elaine Somerville is Assistant Director Social Work with the South Eastern Health and Social Care Trust. And thanks, both of you, for being with me today. Maybe we could start by setting this in context about the value of social care in our society, both social and economic. Would you maybe like to pick up on that first, Paul?
Sure, Wendy. Social care is one of the most important workforces in Northern Ireland, indeed across the world. It provides support, both physical and tasks and relationship building for those most vulnerable in society. So it's a really important workforce, and we need it to connect people into services to support people living in the community and ensure people's well-being.
It's a kind of very mixed area, Elaine, isn't it? Who are the social care workforce, and are they all part of a workforce, or are there other people who are involved in social care as well who are doing it in a different context?
I would define social care as care and support for people to have a quality of life in the community. And that can be provided by a range of different people. So statutory staff, domiciliary, residential, what we would recognise as social care. But there are a lot of informal carers, family members, who look after their loved ones and actually don't receive care from the trust. And they're so important. I suppose society would kind of recognise health professions more because everybody's a GP, everybody attends hospital. Not everybody has experience of social care, but actually during the pandemic, the role of social care staff came to the fore, very much noticed. Our staff went out day and daily to provide care in residential homes, day centres, supported living facilities and in domiciliary to enable people to live in their own homes. And older people and adults have clearly told us that where they want to be is as far as possible in their own homes. And our staff play a massive role in that. They're also a professional workforce, registered now with NISC, and need to be seen as valuable. They have standards and conduct and practice, and they're working to keep people where they want to be in life and to make sure that they reach their potential.
Now, there are quite a lot of social care workers who have had less training, shall we say. There are some who have taken on the kind of training pathways and are following that. And there have been some steps taken to reform social care. Some of them have just kind of happened organically in a way, partly, as you say, because of the pandemic where people's attitudes changed. But what's happened around that whole reform of social care?
I think for many, the way even we recruit social care staff has changed. Anybody can be taught to do anything in terms of a task. That's not what the most important thing is. The most important thing is to have the right person with compassion who wants to be in that job role, because the client will see that. So we have now taken on value-based recruitment to really recruit people in a different way and to know that they're coming. You can't teach people values. You can teach them skills but not values. So that's, and we develop their values and their skills as they move through the system. We have always had a vocational service within our trust. And that's where staff learn on the job and actually can move through the vocational framework into different careers. That's been developed. COVID did hit that though because it's work-based. COVID meant that we couldn't observe the same way, but we still have had over 90 staff in the last 3 years have taken that on. So maybe, Paul, you want to talk about the independent sector, but certainly I'm very proud of the social care workforce in statutory services who kept their development up to date, took on new challenges and progressed through vocational qualifications. And for many, that's the type that they like because it's on the job, it's meaningful, and they can see the difference in their practice.
That's a very interesting point, Paul, that Elaine's just raised there, just to go back to the value-based recruitment, because that's where it all starts, really, isn't it? So maybe if you get that as a basis at the beginning, then it helps move things through. But then there are other people who are already in the system and who aren't being recruited, if I could put it like that.
Yes, I mean, the social care workforce we don't want anybody in social care. We need the right people. So we need people who are value-based, come with personal attributes around communication, being able to record, being able to, I suppose, highlight concerns and support families and individuals. And that intelligence, feeding that intelligence back into the system is really, really important. So we need to train people up in a very skilled way. In relation to the reform work that we've been doing within the council, and the Department of Health have asked us to do specific work around developing a career structure for social care, developing a continued professional learning framework, and it is a value-based workforce, so it has to include those really important attributes that we need. So the point that Elaine raised there around what type of people, how, on the job development, you have to be able to communicate if you want to work in social care, and you have to be caring and compassionate and kind. They're the really important things when you boil down services. Tasks are tasks, but being able to develop those relationships. So, we do have a qualifications framework. We're developing under the reform work around an entry or an entrance level qualification for social care staff. But it's a very complex area of work, and Elaine's outlined some of the areas that social care work within, but they work across an amazing range within our system. Palliative care, end of life, and disability, sensory services, physical disability, learning disability, older people services and mental health, homelessness, addictions. I could go on. This workforce is an amazing workforce. It works significantly across the system, connecting people up in their local communities and supporting them to live the way they want. So, it is a valuable workforce. We have, the numbers of people we have in our workforce is significant. We have 37,104 social care workers on our register at the minute. That's bigger than the IT industry, finance industry, bigger than nursing. But we need to get better at articulating what social care is within our system, within our other professions, and also within communities, so that people understand exactly the value that this workforce brings to society, the economic value it brings to society as well. So the reform is ongoing and is a journey, I think, to be fair, Elaine. This is a lot of work to be done. Absolutely.
There's a lot that we can do locally, and there's a lot that we can do if the executive were back in position, and that we can take forward power to people recommendations and what's coming out from the consultation from Robin Swan from last year.
Let's just talk about those two things for a moment, if we could. The power to people, that was back in 2017.
That's right.
And there were high hopes. But,
very much so.
But that's kind of faded away a bit, hasn't it? And Robin Swan's announcement last year, and there again, there are no politicians now. So what's happening around all of that? Is there any of that people like you are able to implement? Are there things that are coming in, or do they all need kind of ministerial sign-off.
There's a lot of radical thinking in those documents that will need the executive approval, but within trusts and within different sectors, there's a lot we can still do. One is holding on and retaining our very valuable workforce. And we have just completed in South Eastern Trust an exercise talking to our staff with trade unions to find out what was important to them to improve their working lives. Because ultimately, Wendy, that's what's important. People who are treated well will treat their clients well. And there will be an impact there. So we have just completed that. We're about to launch our Pride and Care paper. And some of the things are alluded to in the documents that you've just talked about, and it is about feeling valued by the public. I recall a domiciliary worker saying that the clap during COVID was for nurses, and I said to her, no, it's for you also as a domiciliary worker. So the feeling of being valued by society isn't totally there. Retaining staff through providing mentorship, which is what they've asked for coaching, a learning and development framework, good supervision, good support. When they start in the job, linking them with a buddy to be able to help with the day-to-day difficulties. Paul's quite right. We are now being asked to care for a range of people that years ago would not have been in their own homes. So we're asking a lot of our staff. There's a lot of learning there. So we've got to be available to support them as they progress through their journey in their job and as they come up against new things. For all of us, whether it be the managers or the staff or to the families, it's about outcomes. What are we doing that makes a difference, that helps people live a good quality of life, whatever that may be? And it's in a system that's very tight at the moment. We've tried to look at doing away with time and task and putting more ownership on staff, work the relationship about what's done when they go to a client's home. But then you have the regulation part that actually holds you down to demonstrating the accountability piece. It's in the care plan you do that. That's what's so. There's still a bit of work around that, around moving to relationships and empowering the client with the member staff to take on what needs to be done, as opposed to a very written, static care plan. We've started some of that to see how it works, trialling it. So there's a lot we can still do without executive, but it needs a commitment from everybody to do that. We're willing to do it, Wendy. We have a workforce that we really need to show that we care about them.
That's fascinating. That whole business about feeling valued and the learning and development framework and mentorship and buddying and so on. And I'm guessing, Paul, that's the kind of thing that you would like to see rolled out across the whole area of social care, because there must be a fear among some of the staff that this talk about reform, workforce reform, that the fact that they're kind and caring and compassionate isn't going to be enough, that they're going to have to be better than that. I mean, that's something that you're always worried about, isn't it?
Well, I think with this workforce, they're a very hungry workforce for development and training. They want to be respected. They want to be valued for the work they do. And when you talk to social care staff, within our framework, we do need to look at how we value them. There's obviously the T's and C's issue, and they can need to be continually reviewed and improved upon, and some of that work is happening. Some people have been regraded, but we need to continue to offer progression for those who want it. But when you talk to social care staff around their training and development, they'll often tell you why they want to do that training and development, and it's to do a better job. And so I think they're quite unique in some ways in terms of other people might be more focused on climbing the ladder or progression, but the vast majority of people attracted into social care, there is an altruism there around wanting to provide support because of those personal attributes, and the system benefits significantly in relation to that. But we can't run a system on altruism on the goodwill of a workforce. We have to develop that workforce going into the future, and we have to train them well. We need to develop them well. they have been significantly delegated to over the years in terms of the complexity of the role that they're in, depending on where you work. So we want to see sort of pathways coming out of that. So if you work in mental health, what does that look like for a social care worker in terms of their training, their development and their potential to progress? And similar to older people or children's services or whatever. It's a hugely diverse workforce. And it needs to be and needs to continue. We need to attract more diversity into our workforce because we have an increasing diverse society and we need to train people well. And the outcomes will be significant if we do that. The other point I would make in relation to social care workforce, they are often the eyes and ears of the system. And if we train them up and develop them accordingly, they will provide amazing intelligence and information back into the other professions. So we have some work to do there around our other professions and how they value social care. And that's important work going forward. But the big piece is how do we articulate social care, what it does for our society, what does it do for our economy, and how lucky are we to have such an amazing workforce within health and social care.
How do you take that bit on, Elaine, the whole aspect of other parts of the healthcare system, other professionals and their view of social care workers? I mean, changing attitudes is sometimes the most difficult, isn't it?
It is, and I think, well, first of all, I think we need to listen to our social care staff. I think just from what Paul was saying, we need to listen to them. We need to listen what's difficult about their job, what can improve. So digitalisation, bringing iPads in, reducing bureaucracy, we have really tried to listen to our staff and introduce that. But the other is about having respect across professions and working in teams. And we have some social care staff connected to multidisciplinary teams and GP practices. And it is about social care forums, bringing in other professionals and helping to introduce what each person's role is so that people have an understanding about where they fit in. So for every client, there potentially could be a district nurse in there, a social worker, social care staff, and it's about making sure there's more of a team approach with those staff. And actually domiciliary would be one area that they link very closely with other professions. And I think they do value our social care workforce because, as Paul said, they're the people reporting on a pressure sore, they're the people on skin condition. So whilst they're a social care model, they're looking at the holistic view of the client. So I actually think those areas have improved as people have got to know what each person's responsibility is, and they're working in a more team approach around the client. And I think that has improved. We need to progress it further in how we work out domiciliary care in the future, that is promoted.
I suppose in some ways the very fact that people are now aware that the reason why you maybe are sitting in an ambulance outside A&E for 2.5 hours, if you're lucky, 8 if you're really unlucky, is because actually there isn't a domiciliary care package available for the person who needs to leave hospital but can't go home yet. So that pathway is kind of in our minds now. I wonder, has that helped to a degree?
I think it is for healthcare. People understand it for healthcare. So why is ED blocked up? But when it comes to social care, there wouldn't be the same understanding. I think our prioritisation has had to be in domiciliary. People coming out for rehab, getting out of hospital, the flow through hospital to release beds. But that isn't always known because not everybody has been or had experience of social care. Palliative care, where people are dying, we actively must get the care in there for the last number of days of someone's life. So there is a prioritisation. People do struggle at the moment with that because there are hundreds of people on waiting lists for domiciliary care. And that's difficult for people to comprehend if they've never had experience of social care in the past. Everybody's a GP. Most people have been in hospital at some stage and they can see how one part affects the other. Social care, I'm not so sure that people understand how it impacts on us. So when a patient is in hospital due to go home, they are going to get priority because we need the throughput. Health and social care is so interlinked. And we need our domiciliary to be providing the care to get people out of hospital. That then impacts on people in the community who perhaps need more packages. or a new person coming on who needs a care package, never had one before. And I think that's difficult for people to comprehend. It has got, and from COVID, there's a lot more people on that waiting list. I think the concerning thing would be there's no new investment. And we've been told moving forward this year, there's no new monies. So what we need to do is make sure we are as efficient as we can be, and that the people using the care are those who need it.
You wanted to come in there, I think, Paul.
Yes, and it's easier said than done as well. I think one of the big pieces around the social care workforce is its complexity. I mean, we have 75% of the social care population, and that's over 37,000 people working in the independent and voluntary sector. So being able to integrate across the system in a seamless way to respond in a way that's needed is a huge ask for this workforce. So I think in terms of the future, we do need to reform and modernise social care. We're not the only ones that need to do that. This is an issue right across the world, Europe particularly, and indeed in the UK. So, Elaine is right. You need to resource, invest, articulate what actually this workforce is doing, and also what it's capable of doing into the future. And we need to do that, because we're not going to attract millenniums into a social care workforce unless we have a good range of training, development, support. And we know that, Elaine's talked about, well, what can we do? We're waiting on an assembly to maybe connect into other parts of the reform for social care that's required. But what we can do is look internally at our own organisations. We can work across in the Social Care Council, work with a range of senior leaders in social care around articulating and feeding information back into the system. So we need to listen to the workforce. We need to understand what would keep them in social work. So I think the point Elaine talked about earlier around retention is extremely important, because there's a lot of emphasis often on recruiting. And as I've said previously, we have a finite workforce in Northern Ireland, and everybody's competing for that workforce.
And you want to keep your good people.
So, retention strategies, starting to support organisations to understand and ask the questions rather than waiting for an exit interview, because this workforce have huge intelligence. And as Elaine said, when you talk to them, you get that richness of information that will help policy, it'll help operations, and it will help improve a lot for people who require social care support.
Elaine, you talked about being more efficient and how everyone's going to have to work in that way given the financial constraints that apply to the NHS in general and to health, social care and so on, perhaps in particular. What do organisations need to help develop and retain their workforce? What can they do within those financial limitations to be more efficient and to work better?
I think there's two things. One area that we haven't been able to take forward the way we would have liked would have been our MDT teams linked with GP practices would have social workers and social care staff. And that's about the preventative piece and the early help. And if we get that right, we can put off people coming into the system for much longer. If we support carers to help them to look after themselves, to get respite, they also could be looking after their families for longer. So there's some things we need to do way in advance, and we need to use social care staff in that arena as well. That does need to progress moving forward. We haven't been able to do that because we're so clogged up looking after with the basic care needs of folk coming out of hospital and all the rest, as I've talked about. So there's so much, and we're so enthusiastic, Wendy. We can see so much that we can do moving forward to change the scales, to change the way things are done, and the radical thinking of part people. And it will come through, and we haven't had the feedback from the engagement from Robert Swan. It will come through. There is so much could be done to change the way things are. At the moment, we have an ageing workforce as well, which is a real concern. So we're actually trying to attract in new people. We have kept our staff for a very long time, so we are doing a lot right to do that. For me, I think it's about making sure we consistently ask our staff what would make a difference for them. Lives have changed. A lot of our staff are already carers as well at home. They want their working hours differently. And we've always had the mindset, oh, it must be you come into work at this time, you go home at this. We've had to change our thinking and look at work patterns and look at how we can do things differently. And that's about listening to staff and taking on board. They all have commitments at home. They need to do things in a different way. And part of that's also training for managers. Because if they also aren't carers at home, they maybe don't appreciate that that's what the people... So it is about looking at what our workforce is telling us that would help them stay in work, because that's where they want to be. So there's a lot we can do, Wendy. But the radical stuff about changing the balance and people coming in at an early stage and then staying in care for many, many years, we can't do that on our own. We need financial investment for some of this. And there's no new money coming this year. But we can do a lot. And that's about listening to staff and doing the tangible things that would make a difference and encourage them to stay. Our staff consider themselves, and they are, professional workforce. They're registered with NISC, they're assessed by RQIA, and there can be a lot of boundaries around that. So it's about acknowledging just how professional they have become over the years. And it's needed because there's such a bad press regarding social care. We hear the stories when things go wrong. We're maybe not so good saying when things go right. And there's a lot of very good work happening out there.
Is there enough conversation, enough exchanging of information, Paul? You know, when we hear about what Elaine's trust has been doing, that whole listening exercise, making sure that they hear what their workforce want to feel valued, they want their mentorship, they want their kind of buddying frameworks and so on. Are other organisations doing the same thing? Or are there different things going on in that very Northern Ireland way, within 200 yards of each other?
Well, I think we have a very amazing workforce right across, whether they work in the voluntary, independent or statutory sector, and often people will work across that system. But we need to make sure that we don't cause problems with that in terms of destabilising services by people moving across. And Elaine touched on, needing new people coming into social care. We do have an ageing population, we have an ageing workforce. We need to do a lot of work around retaining our existing staff. And any job, people will tell you the reason they leave is because they feel undervalued, they don't like their leadership or management. There's loads of very key things that really push people to make an application elsewhere. And it takes a lot of effort to do that. It takes a lot of thinking before you change a job or a role. So we need to be mindful of that, given the pressures in the system, as Elaine's outlined. So we need to help organisations understand, about how they can step up, and there can be a focus on what we haven't got, and we do need resources, and we do need investment, and we do need better T's and C's, and we know that.
But is there a good kind of learning from best practice going on? Is there an openness to seeing what's happening in another trust, perhaps, or in another setting? Very much so, Wendy. I mean, when we have the privilege of having the overview in social care, both within social work and social care. And you can see the innovation out there. You can see the trusts, the independent sector, voluntary sector. They are working incredibly hard to try and bridge some of those difficulties and challenges. It is a challenging role in social care. And I heard a story from our chief executive last week when there was a celebration event this week in the Northern Trust, and one social care worker went out to do her job and ended up having to do CPR to keep somebody alive. I mean, this is really important work. It's valuable work. It needs to be articulated better. And Care to Chat, this series of podcasts are part of that. How do we connect with our community around understanding of social care, and also the work that's needed with carers, and Elaine's touched on that, of the expectations from our society. And we have
increasing expectations from the health service, and what's achievable and what's doable are two different things. But we do know that people value, people who have had access to social care, and I certainly had with my parents before they died. You know the value of good support at that time. They're really key times in people's lives that they might need social care support. And we will all be touched by that at some point in our lives. So we want to have a really good workforce to support that. The other piece, I suppose, is the recognition that this workforce on its own is not going to sort all the ills of today or tomorrow, because there are issues within the acute. Do we look at new ways of working in terms of getting, rather than having somebody sit in an ambulance for 24 hours before they can get a bed? Is there, and there are really interesting pieces around, sort of pathways into hospital. So if you can keep people at home supported with technology, they can register their own well-being, so they're not getting to the point where they need a hospital and into an ambulance. So I think we need partnership across the system to make sure we can get things as good as we can. And we need to develop community development around this workforce, because lots of people in communities, we need to empower them to be creative, because this workforce can't solve everything, but it does a hell of a lot.
Mm. Those partnerships are crucial, Elaine, aren't they? And I mean, like many other organisations, the health service tends to be a bit siloed, if I might put it like that. Mm-hmm. So how do you get those cross-silo partnerships to work effectively?
Well, when I managed domiciliary care a number of years ago, our partners in the independent sector were very much part of our team. So when we were trialling new ways of working, we would have, through our contracts department, included all providers to see who would want to take part in that. It is about including everybody, and everybody's a role. Actually, a number of years ago, 80% of domiciliary care was the independent sector. In our trust, it's not as overall, it's like 65, but in our trust it was 80. 20% were statutory. So we need all of our partners. Everybody has a role to play, and it's about respecting that. Mm-hmm. It's not about a threat. We can't do it all. So no matter what we were doing, we could contracts, meetings, involvement of our partners. And then when we were looking at new ways of working, involving everybody in that. We had some really good work taking place on care and support at home and doing things in a different way. And it was independent sector as well as ourselves. And they were there at the meetings and taking part. So it is, and it's making sure our contracts are fair, and we listen to our partners as well in terms of what their difficulties are.
With all the work that you're doing and the listening that you've been doing, and that's such an important thing, I think, in any organisation. But how does it make you feel when you hear people saying that the system's broken? This just doesn't work anymore.
The system has real difficulties, Wendy. There's no two ways about it. But the system aren't the staff. The system's bigger than that. The system is just the pathways, how we work. The staff are what make a difference within that. So, yes, the staff will tell you that they can see what could be fixed. We do need financial investment. You heard nurses talk about clapping for nurses. Doesn't pay the bills. Our staff are the same. They need valued in terms of what they do, the complex work they do. And yet some people can't see that it's any different than going and working in other sectors. It absolutely is. But there are some things, and they do recognise that we can't always sort that out. There's some things we could, though. We have different bands of staff working across social care. We could make generic job descriptions, and we could have people working all in the same bands. There's a lot we could still do.
And is that the kind of thing that you're looking at in the Social Care Council, Paul? That sounds like enormously good common sense, actually, doesn't it?
It does. And, it is within our gift. We have service improvement opportunities that are happening across the system. And that's about looking at how do we do things different? How do we learn from the information we gather? And the council has certainly been very mindful around gathering data and information, and we've spent most of this year, part of our reform work was around discovery, and that's about sitting and talking. We have used a design methodology when we've developed this work. So it needs to be developed with people. When you're working across a broad range of sectors in social care, you have to listen. It isn't sitting in the room and coming up with ideas that we think the nanny knows best. It is about good evidence base, and we have spent most of this year engaging around our work, the reform work that we have been doing, and we've gathered amazing information from this workforce. They're a very difficult workforce to get at because they're doing 60 hours a week,
busy.
some of them. Yeah. So, being able to access frontline workers, we want to see respect in there for this workforce, in terms of we're in the framework, we're talking clearly about social care practitioners, and that's what they are. Enhanced level practitioners in social care, and indeed leadership and management within social care. So there's those progression pieces are there. But in terms of how do you harness the knowledge and skills, you need to be structurally changing to allow that. And, Elaine's talked about some of the work they're doing in the South Eastern Trust in terms of focusing more on progression for people. The mentoring and coaching is really, really important for this workforce because they are out there dealing with real complex pieces of work, and they're not on a tram track often. So you need to be checking in with this workforce, supporting them, looking at what works and what doesn't work, and how can we best support them. And you need to be an employer of choice to attract good people in and keep them.
And I suppose, Paul, just to say that there's a lot of celebration about what we have taken forward. A lot of our social care staff have taken on new models of working, like supported living. Before, we either had you lived at home or you went into a residential home. Now we've supported living with our staff looking after people in a supported living complex, but they have a front door, they have their own apartment, and over the last number of years, they've really taken forward that model of care. So new models have come through, staff have embraced it and actually loved the fact that it has improved the lives of our clients. So all that is happening, Wendy, in the absence of the bigger decisions. So there's no doubt health and social care is moving forward, even though we're waiting on some of these changes being ratified by the executive, and they couldn't come quick enough.
On that point, I think I'll say thank you very much indeed. Thank you to Elaine Somerville, Assistant Director of Social Work with the South Eastern Health and Social Care Trust, and Paul Rooney, Professional Advisor with the Social Care Council. This has been Care to Chat, a podcast from the Northern Ireland Social Care Council. Thank you so much for listening. And if you'd like to learn more about careers in social care and social work, visit niscc.info, where you can find inspirational stories, great learning resources, podcasts, and much more.